Doctor, a lot of the conditions and things we've been talking about in just a few minutes, you refer back to the thyroid, it seems like quite a bit. Why? Why is that? Why is that so important?
You know, the thyroid happens to be the gas pedal in your body. When your body decides to do something, the thyroid says, hey, let's put the metal to the pedal and we're going to go down, and then the adrenal gland kicks in and releases fuel. So your metabolism is dependent on optimal thyroid function. Your thyroid gland is located like 2 finger breadths below your voice box. If you can feel like an enlargement here, it's probably wise, if you have difficulty in swallowing, to have your healthcare provider assess you. Common body signals, so these are really important for subpar thyroid function. And by the way, 1/3 of the world, statistically according to WHO, World Health Organization, have low thyroid or subpar thyroid function. Cold hands, cold feet, very common. Depression, because there's an important protein for thyroid called L-tyrosine. L-tyrosine and iodine make thyroid hormone. Elevated cholesterol, constipation. We have an epidemic today of people who have thin hair, especially females. It's like $1 billion industry now. Low thyroid gland. Waking up in the morning with a headache that goes away as the day goes on. Subpar thyroid. Can't lose weight. You've been trying and trying. Subpar thyroid. I'm going to go back to these cold hands again. Very common body signal in our practice. If someone's been diagnosed with a condition called Raynaud's, Raynaud's is really, from our observation, subpar thyroid function. Cold hands, cold feet, depression, wide-spaced teeth, thinning hair, common body signals for subpar thyroid function. Now, we're going to give everybody a really simple test to use. This is a very large thermometer. We're using this as a visual, but the point, you can get a battery-operated one, or you can get more of a traditional electric one, or traditional one, and then or electric one. What you're going to want to do, if you have a traditional one at home, shake your thermometer down, put it in your armpit area when you wake up in the morning. Don't go to the facility. You lay there for 5 minutes and you look at your temperature. It should be 97.8 or above. If it's 97.8 or below, and you have those body signals, cold hands and cold feet, I would encourage you to have a blood test done for your thyroid gland. Now, this is very important information for everybody right now. Traditionally, the healthcare community only has done a TSH. TSH stands for thyroid stimulating hormone. In our practice, we want it to be above 2, right at 2. Typically, they only do this one, so if it's elevated, they'll tell someone they have low thyroid, they'll put them on a medication, or they'll suggest a medication. And then you can see 2 other numbers I have there, T4 and T3. 80% of thyroid hormone is T4. The range is between 4 and 12. We like to see it be at 8. If it's less than 8, you may need some iodine, and you may need some L-tyrosine. Obviously, you always want to talk to a healthcare provider in regard to that. But the one that a lot of people miss is T3. So 80% of thyroid hormone is T4. It's 20% effective. But 20% of thyroid hormone is T3, and it's 80% effective. We see a large number of people who have normal T4, which is on here, but a low T3. Let's say down in the 90 range or so. That individual has stress. Stress will lower T3. T3 is the active thyroid hormone, and that's an area that you want to elevate. Stress, I got to tell you a story. We had an individual that we are helping her thyroid tremendously, and she came in one day, she was so angry at me. And I looked at her and I'm like, what's going on? She said, well, my thyroid is not working. It was working here, and it stopped working. What did you do? So I went back and I looked at her thyroid test, and for 2 years she was doing good. And all of a sudden it did drop. Well, that's when her alcoholic son, who was graduating from college, was going to move home. And it's when her high school senior was going to volunteer and join the military. So I pointed that out to her. So I learned from her, stress can sabotage it, the thyroid gland. Now, a lot of people have a very interesting misconception. Cruciferous vegetables, broccoli, cabbage, and cauliflower, they will say impair thyroid function. Well, I beg to differ, and here's why. Only 14% of the people watching you and me right now eat enough fruits and vegetables in a day, 14%. But 30% have subpar thyroid function. So it's not broccoli, cabbage, and cauliflower. And if you want to eat it, saute it, eat it raw. But most people don't even eat, they hate broccoli. It's the iodine, or it's the bromine, fluorine, and chlorine from the shower, compromises thyroid function. But I'm going to tell you, two big culprits. It's soy. Soy will impair thyroid function. It has estrogen in it. And so will gluten will impair thyroid function. So avoid gluten. Soy's everywhere. So just be aware of soy in your body. Cold hands, cold feet, wide spaced teeth, thinning hair, very common body signals. If you have those body signals, you want to make sure that you address that, because if you have subpar thyroid, you're going to have constipation issues. If people have constipation issues, have liver issues. If people have liver issues, have other issues. So we look at it the whole package. That was a real important nugget. The thyroid is the key.